If there's one thing we ought to be thinking about these days, it's how can we improve our health without more drugs and medication of all sorts. There's got to be a new wave in healthcare where we're going to look about how can we stay healthy, what can we do to help ourselves. We are a densely populated town, very compact town, which means that we can get around quite well, but also people can get lost in it and become lonely. The need is clearly there. It's everywhere, it's not just Crawley.
The patients who get the best out of it are patients who are the most vulnerable and in the greatest need. People who have severe long-term conditions, who are housebound, who become socially isolated and lonely because of that. People who have cancer, and a lot of the problems may not be related to the cancer. It may be due to housing, it may be due to money, it may be due to other things.
In my experience, what I've found is there are a few underlying issues that cause people to come back to the surgery, and it tends to be around depression, anxiety and social isolation. So those seem to be the three underlying issues.
It is about empowerment of the patient. So empowering the patient to make the right choices for themselves, they're more likely to improve their health and their well-being.
The elderly population, and I think that's mainly due to the loneliness, and we all know that's been well documented, and it is and does have such an impact on the NHS.
You know, we know that there are people who are isolated. We know that there are people who would benefit from more social contact.
Because they are lonely, everything feels worse, their ailments feel worse for them, and it's just having somebody to talk to, go to a club, meet friends, just feel they belong, even once a week. If that's the only time they go out, that has a huge benefit for the rest of the week, and it gives them something to look forward to the next week. So their mental status improves dramatically.
So it's a great thing, it's social prescribing, being prescribed coming to the posh club instead of having some medicine. I think it's a great thing, you know, it's good for the soul.
Sitting at home all day, every day, you know, with very little change of scenery is absolutely awful, and I look forward to coming out, look forward to going somewhere different. Look forward to seeing Tracy and seeing my friends, new friends that I've made.
Yeah, she's lovely, Tracy, absolutely wonderful.
And okay, a lot of the people that go through social prescribing have got ongoing conditions or issues, but to help them not be weighed down by those, to find that there's a life out there, and that's going to actually improve their overall health. It's got to be the way of the future, it has to be.
We have a whole host of patient stories which say how wonderful it is for them, how life-changing it is for them.
We've always known, haven't we? We know individually the connection between the mind and the body, and how we feel in ourselves and about the world and the impact it has on our health. We sort of all intuitively know that, don't we?
Well, they socialise, that, you know, they're making friends, you know, interacting with people, they're getting some exercise, we get up and we dance and we laugh.
But it's a chance to get your glad rags on and get out. There's more to being old than doing nothing. There's an awful lot to investigate and to broaden your horizons. So I would recommend it thoroughly.
The usage of hospitals and the sickness services reduces. So it's a really important part for the sustainability of our NHS and our care system.
And we have noticed a reduction of them attending appointments. So it's a win-win.